All right, we are good to get started. Allow me to bring on Dr. Sharma, who will be going over everything hair transplant. All right, Dr. Sharma.
Okay guys, good afternoon. It's nice to have you all here. Before I begin, I would like to say speaking on camera is not my main forte, so forgive me for any sort of mistakes or any sort of cumbersome things that I come across. And also technically, I'm not really a computer program guy, so we'll do our best to sort of get through this without any technical issues. So, Alex, do you want to just show me where the...
Certainly. All right, so to start things off, we thought we would go through a bit of a presentation. What we're going to do is share our screen, and basically you will be able to see everything we are seeing. And here we are. So this is the first page.
Yep.
And you get started.
Great. Okay, guys. So let's get rolling into this. So firstly, I'd like to read out this disclaimer. It's very, very important that we all understand that this presentation is for educational purposes only. It is not possible under any circumstances to medically advise on the individual cases that we're going to see today, or if anyone asks any questions, without a formal medical consultation. A surgery carries such a large number of variables and risks. All cases discussed today are for information purposes only, and it's very important to realize that results will be different according to personal circumstances. All information is proprietary and must not be shared or disseminated without our consent. And the images that you will be seen, that you will be shown today, have been done so with full consent of the individual patient. So let's get started. So when we first talk about hair transplant techniques, classically there are two main schools of thought. The very old-fashioned technique, which is still held its test of time, is the FUT, or otherwise known as the follicular unit transplantation. And here what happens is we're taking a strip of scalp from the safe donor area from the back, and then dissecting that into each individual components to transplant into the recipient area where the patient needs more hair. As we can see here, that does leave a linear scar, but depending from surgeon to surgeon and the techniques to use, these scars are a lot more indistinguishable from what we see here, which is not one of our patients. But it's important to realize that it is a very, very good technique. It has stood the test of time, and it has its advantages and disadvantages like every other technique. And then here we have the follicular unit excision technique, which is otherwise known as FUE, which is whereby we shave the safe donor area down to about a 4 millimeter clearance. And then we're taking each individual graft out with a motorized punch. The diameter varies from anywhere from 1 millimeter to 0.9 millimeters. And that means the internal diameter is anywhere from 0.8 to 0.9. So quite tiny holes. And the trick here is to really harvest over a very, very large surface area and do an even harvest when we typically do surgery, where measuring the donor area into its component measurements, and then each area is given an even harvest, so it's very, very even. What we don't want to do is just take a large amount of hair from this area here, and then you have a patchy area, and then everything else looks very asymmetric. So we try and sort of be very precise in the back as well. So, and then let's move down. Now, with the follicular unit transplant technique, we're taking a strip of scalp from the back, roughly about 18 to 20 centimeters long, a centimeter to 1.5 centimeters wide. We're then taking that piece of tissue to make sure we're not cutting the root when we're cutting, and then we're closing it with a 3-layer closure to make sure it's a nice wound. Even if we can't see it, it's very important to do this very slowly and methodically, because you know, we want to make sure we have nice surgical results. So the good thing about this technique is, of course, if you have longer hair, when this wound is healing, all of this longer hair here that my amazing nurse ties into lovely ponytails will hang down, and therefore it will cover the wound. This is typically good for patients who don't want to sort of shave all their hair if they've taken a long time to grow their hair. But what must be said with this technique is if you're transplanting hair into a recipient area and there's lots of your existing hair, we may need to shave the front area down. So it kind of depends upon what you're looking for. Typically, a lot of females tend to go with this technique because they do have longer hair. But nowadays also, a lot of females are also opting for the FUE technique or the window technique. So it all varies from person to person, and we can go through this during the consultation. That's what it's there for. Now, with the FUE technique, once we've taken the strip, it's then dissected into its individual components. And here we see the skin that you would see on the very, very top here. And then we've got the roots that are sitting in the fat layer here. And really, it's important to make sure these are treated with the utmost care, because if these become damaged during dissection or implantation, it's completely a no-go zone. So typically what happens is my staff will come in using a very focused pair of microscopes, and they'll actually cut this into its individual components, depending upon what kind of grafts we're looking for. Now, as we move down, this here is a small sliver of the scalp. And once again, you can see the roots a little bit more clearly here. This patient was a very nice man we operated on from of African heritage. We went for the FUT technique because to do the FUE technique, you'd simply cut through these because as you can see, the roots are not sitting directly in the same trajectory as the FUE blade. So if we went in here, you'd actually cut these roots, which is a complete waste of time. So therefore, we'd like to visualize it and then slowly carve around these individual roots to make sure we get them out. Now, let's talk about the FUE technique. For the FUE technique, we are going to measure a very distinct safe donor area. And then we're going to evenly harvest the grafts under local anesthesia. As you can see here, the scalp is thinned out. And depending upon what procedure you do, how many grafts we need, and the pre-existing density that you were born with, that's what will dictate how thin or patchy the back will look. And we'll talk more about this because for myself, just a personal sort of take, it's very important that the back looks good as well. Now, there's no free lunch. If you're going to take grafts from somewhere, it is going to look a little bit thinner or sometimes moderately thinner. So it's important to sort of really know what you're getting into. Now, if we slip across to here, this is the extracted follicles all placed nicely on a swab just for information purposes. Once again, this is the patient who was from Africa, and as you can see, his roots are almost sitting at right angles to the actual exit trajectory of the keratin shaft. So very, very interesting. I wanted to share this with you because it's just nice to sort of see an interesting case rather than a very straightforward case. So normally what happens is the roots sit here and then the actual shaft exits like this. But as you can see here, he has his roots here and the hair's almost doing this. And that's why sometimes an FUT technique is the right thing to do because not everybody is suitable for an FUE. So let's just zoom out. And now let's talk about the FUE donor sites. Everybody is different and everybody's born with a different density of hair in the back. And that sort of depends upon ethnicity, previous medical conditions, etc., etc. This is simply a very straightforward slide to exemplify what some of these patients look like post-surgery, and it also gives you an indication of what their pre-existing density was. So this patient here, he had medium density, for example, and this is 6 months post-surgery. We did about 2,500 grafts here. And this little white box here is where we took the grafts from. So as you can see, this is a number 2. You can see slightly through the hair. If that was number 1, perhaps you'd see it more, but obviously, it's all about sort of using the right hair length in the back. This man here, he was also medium density. He's 11 months post-surgery, 2,200 grafts approximately. He wears his hair slightly longer in the back, and as you can see, it's very difficult to see anything there. Now let's move down. Now this chap is one of our superstar patients. He came in with quite severe hair loss. We stabilized it, and then we proceeded to 2 surgeries, which were planned and discussed. The fact that he may need another one after the first one. We did about 3,500 grafts in total. He's got lower density, but as you can see, he's chosen to wear his hair longer so we can actually hide the patchiness in the back. And obviously, it looks better than if he was wearing his hair short. And this man, of course, very, very lucky, very high density to begin with. We did about 2,300 grafts, and that's 6 months, and you can hardly tell anything there. Once again, this is the donor site 1 year post-surgery. This is before, and this is after. As you can see, you do have some slight thinning. And really, the aim of this webinar is not to sort of tell you guys to do anything. It's really sort of give you the hard facts about what's entailed and how things work in surgery. A lot of people come in and they think the FUE technique, it's like the miracle of hair transplant. It has its advantages, but also it's important to realize we are collecting the ingredients from somewhere, and that's the back. And obviously there will be some thinning, and it's important to sort of choose about how you're going to wear your hair. Now let's just talk about one thing which a lot of people are scared about during surgery for quite obvious reasons, and that's pain. Oftentimes people are wondering, is it going to be painful? We use local anesthetic during the surgery. We use something called a ring block, which blocks the nerves that travel from the front of the scalp and the back to basically anesthetize the scalp. Depending upon the case, we use a mixture of a short-term anesthetic and a long-term anesthetic, which usually ensures that the patients have no pain. It almost feels like you're wearing a helmet. So during the procedure, you are completely blocked, and that should last about roughly 12 hours. You may require a top-up sometime during the surgery, but that's entirely normal. And also, it's important to realize, depending upon your previous medical history, how big you are, how much you weigh, that sort of ultimately dictates what dose and how much you actually need. Now, this is a really, really important slide here. So in the 1950s, there was a very clever man called James Hamilton who invented a scale to assess men who are losing their hair. So doctors could sort of communicate with each other and the patients and almost have like an evolution of how they're losing their hair. And this was called the Hamilton hair loss scale. This was then updated in the 1970s by Norwood to sort of encompass a wider array of information to sort of make it more accessible for varying degrees of hair loss. So we often refer to it as the Hamilton-Norwood hair loss scale. Now, this has sort of been abbreviated here into step 1, 2, 3, 4, 5, 6, and 7, rather than all the little sort of minutiae of 5A and 2A and 2B. And really, it's about understanding where you are on this path of hair loss. Now, this is assuming that you have androgenic alopecia. There are lots of different reasons for hair loss. So the first thing, of course, always is go and see your medical doctor and make sure there's nothing medically wrong with you, because Androgenic alopecia or male pattern hair loss is not a disease. It's a condition like having blue eyes or green eyes. It's a genetic inheritance where you're actually receiving a receptor on the top of the scalp that's sensitive to DHT. So here we see class 1 is basically normal. Class 2, what you're going to start seeing is you're starting to get some recession into the temple area there. And with stage 3, as you can see, the V is getting a little bit steeper here. These angles are getting a lot steeper. But also what's happened is this frontal hairline is starting to recede backwards. And that's 3. Typically, a lot of men will present somewhere around these 2 areas, but also here. So the majority of cases that we see fall somewhere into these areas here. Now, with 3 and 4, what's happened here is the crown or the vertex also starts to become involved. And by 5, what you've got is it's actually creeped into the mid zone as well. There's really just a tuft of hair in the front and then a large area behind, almost like an island. And then obviously 6, you've got more obliteration of the follicles. And number 7, obviously, you can have quite severe recession down into the back there as well, if there are genetically prone follicles there. Now, I want to make something very, very clear. It's very important to be realistic about where you are. And that's why I always tell patients, go into your GP and get a consultation first. Because if you are somewhere like around stage 5, stage 6, stage 7, it's really, really important to go make your hair loss stabilized first. Because the more hair that we can actually stabilize and you can grow back yourself, the less surgery you'll need. And oftentimes when I'm seeing patients in stage 4, 5, 6, and 7, I'm often having to send them away and say, look, go and take medications, go and stabilize your hair, or try to get as much growth as you can back endogenously before you come and see me. Because it's very important to be realistic about what the outcomes of surgery are going to be. And it's important to talk about that before the surgery, not afterwards. So just make sure you understand whereabouts you are and, what the realistic outcomes are. Now, let's talk about the different areas that you can restore with hair transplant surgery. So here we are, stage 2. This chap came in, quite a young man, very, very straightforward surgery. We stabilized him with medication, transplanted him, and that's his result. Here, the mid zone, he's sort of creeping up into a 4 there. As you can see, we restored his front and the mid zone, and obviously medication as well. And here we've got the crown here. And he had sparing of the fronts actually, which is quite good. Just some other nuances for hair surgery. Obviously, the beard can also be affected. This man just had genetically very low density around his beard. No medical conditions, absolutely fine. And we successfully transplanted his beard. And this young woman, she overplucked her eyebrows due to aesthetic reasons, and then she obviously had very thinner eyebrows later on in life. And what we did was we simply transplanted the eyebrows here. So not everything is about the scalp. There's other areas as well, but the main things that we see is the scalp. And now let's talk about the donor area. So this is actually our special guest who's been very kind to participate in this education. This is a picture of the FUE technique 5 days post-surgery. So as you can see, everything has been shaved down. And these little white dots that you see here, let me just zoom in here a little bit. These little white dots here are where we've actually taken the individual follicles. It does look patchy. You've got some scabbing there as well. So these little black areas or dark areas is eschar, and it's basically a bit of scabbing. And we keep you on antibiotics for 7 days, and this will sort of heal in, and you'll get post-wound healing there. Now let's go into a larger surgery. This is 2378, so this is 10 days post-surgery. As you can see, the demarcation of the donor area, a little bit red, inflamed, entirely normal, but the hair is coming in nicely. And then once again here, we've just got some more pictures of the different examples of the donor area post-surgery, depending upon how you started off. This man here, a little bit older, he had lower density to begin with. He had approximately 2,600 grafts. This is 1 year later, FUE technique. And as you can see, it's thinned, but not drastically enough. So yeah, so. Now, let's just talk about this one here. Is hair transplant surgery right for me? Well, the first thing I need to say here is you need to really think about, is your hair loss, what's the main cause? And I always tell patients, once again, go and see your doctor to make sure there's nothing medically going on. Because you never know, sometimes we do get patients, they come in, they've not done that, and we pick something up, and then of course we send them back. But usually speaking, androgenic alopecia is a clinical diagnosis based upon the history of hair loss and how it looks, and blood tests are not needed. So here we have just the frontal hairline here. We finessed this. He had some recession into this area here, and we basically thickened that up and just made sure he's got a thicker frontal hairline. And we also went into the back here as well. Just put that in red, actually. This chap here, a very young man, he had quite severe recession along the front. We stabilized the hair loss with medication, and obviously we've transplanted this area back, and that looks very, very nice. This chap here, more aggressive picture here, Norwood 2/3. We've done 1 transplant here, very, very good. And he, as part of the surgical plan, we made it very clear that he would probably need more surgery in the future to sort of give him the optimal results. So we're going to wait for like another couple of months and then make a decision there. This man here, very, very nice man to operate on. He lives in a lovely part of the US now, enjoying the weather. He came in with thinning of the crown. We stabilized him with medication, so we stopped or we diminished the probability of losing more hair. We transplanted him successfully, and obviously it worked out very, very nicely. This man, he had very aggressive androgenic alopecia. We stabilized him with medication. He actually had 3 surgeries with myself, which were all planned. You know, Rome wasn't built in a day, yeah, and that's the end result. Very, very pleased there. Once again, frontal hairline. This man wanted a very low number of grafts, which we obliged. So we did the best with what we could. He just wanted this area here, using a very minimal amount of grafts, and that's okay. And obviously it's worked out pretty well. In my opinion, I would have liked to have done more grafts to sort of give him more coverage here. But you know, like I always tell patients, we all have a budget and we all have to be realistic in terms of what we can and cannot do. This picture here was sent to me by a very lovely man who flew in from Victoria to see us. Those of you watching from Europe, Victoria is a lovely island off the western coast of Canada. Anyway, so he came to see me and he took a picture of himself before the surgery with his little cute boy. And this is 3 years on after surgery. And as you can see, his son's got older and obviously he's got younger, but yeah. I always tell patients, these are just a few examples. Obviously individual results vary, and this is just what some of you want to see. Okay, now let's go into planning of the surgery. So on the day of the surgery, we shave you down completely. We make the recipient planning area. This is already sort of discussed with you during the pre-op to give you a guesstimate of how many grafts we need. Of course, final results are very difficult to promise because so many variables in surgery, but we kind of give you a rough idea of what we're going to aim for. Let's talk about recovery. You have a bandage around your back of the donor area for about 3 days after surgery. That should be changed at home. Sometimes if you're living in Edmonton and a lot of our patients are bachelors or they don't have anybody at home, we always tell them if you're going to have difficulties, just come into the clinic and we're happy to change it for you. The main thing is it must be done well and very, very clean. This is one of my very earliest patients in Canada. He has had 3 surgeries with me now. He is the one on the first picture with a low density who had 3,500 grafts plus, but we transplanted him. And this is in 1 week afterwards. And as you can see, week 2, the recipient area still has some scabbing on there. And then week 3, some more scabbing, but it looks a lot better. So I'll zoom into this slightly so you can actually just see a little bit better. There we are. So week 1, week 2, and week 3. And here we've got week 4, week 5, week 6, and week 7. Now, what will happen is oftentimes patients will become quite anxious around week 5, week 4, because some of the they think some of the grafts are falling out. So this is the gentleman that we saw in the first picture who had 3 surgeries, and that's him after. So I'm quite pleased with these results. Now, redness post-transplant is very, very normal. A lot of patients become very anxious. This is clearly discussed numerous times before the surgery. You are going to have redness. It's like saying you want to make an omelette without breaking the eggs. It's not possible. The redness can persist anywhere from 4 to 12 weeks. Sometimes it can even last several months, depending upon the color of your skin and how contrasted it is. By sort of 2 months, it's more of a salmon hue, like poached salmon, not red, but you will have some post-transplant inflammation and redness, and that's just part of the parcel. So this man here, thinning in the front, 24 days post-surgery, bit of redness there, and this is 6 months. Okay, and then let's slip onto page 2.
Actually, that's all we have for the whiteboard slides. Okay. And we will now be moving over to our guest speaker. So would you introduce him for us?
Yep, so this is a very, very dear patient of ours, known him for several years now. His name is Alys, very, very kind man to give up some of his time for us today. A lot of patients are often asking us, can they speak to somebody who's had the surgery, who can give us a little bit more information. I really like Alys because his wife is actually in medicine herself. He is a straight shooter. I didn't want to bring on somebody who was like, oh my God, surgeries, a walk in the park, etc. You guys know me by now, those of you who do. I like to be very blunt and honest about what to expect and what not to expect, because what you say carries a great amounts of value in planning surgery. So Alys was a great, great guy because he's very honest, to the point, and I thought it'd be very helpful for you guys to go through his journey and sort of see what it feels like from the patient perspective. So yeah, without further ado, I'll let the more handsome man than me go.
Hello, 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 hello. Thank you all for joining us today. If you're on this webinar, congratulations. You're taking the first step to correcting your hair loss problem or issue or concern. I was there once. I totally get it and understand. It's exciting, it's scary, it's nerve-wracking, it's every emotion. It's a roller coaster. So I've been there. I understand where you've been, and hopefully you can walk away from today's webinar with a little bit of peace, and with your questions answered. A little bit about myself. My name again is Alys. I did get 2 hair transplants, FUE hair transplants at the Sharma clinic. The first one actually in 6 days will be exactly 3 years, which I can't even believe that much time has just flown by. So my first surgery was 3 years ago. My second surgery was 22 months ago. So some time has obviously passed. With the surgeries combined, I did get about 3,800 grafts with the 2 of them combined. And I am extremely, extremely satisfied and happy with the results and where I am now. I can't even believe the journey that it's been. And I'm excited to share that here with you guys today. So for anyone that does know me or has heard some of these past videos that I've made for Dr. Sharma and for the clinic, hair has always been an absolute piece of importance to me. It's been a part of my identity. It's how I express my creativity, show my personality. So over the years, I always had extreme hairstyles, extreme colors, glues and straighteners, and you name it, it's been through my hair at some point in my life. And I love hair. I do love my hair, and I enjoy what I can do with it. So that's why you'll see me with a different hairstyle almost every day. And with every picture we probably go through here, you're going to see a different hairstyle as well. But it's always been something that's really important to me. And recession or hair loss happens really, really quite slowly and gradually, and you really don't notice it, to be 100% honest. Years pass before you're like, whoa, I've actually lost a lot of hair at this point. Is this something that I need to address or fix? And for me, it happened so slowly, and even the people around me didn't even notice that I was losing my hair. Once I got my first surgery, I remember everyone always asking, you weren't even that bald, you weren't losing that much hair. But then you look at the pictures and you're like, whoa, actually, I didn't even realize it was that recessed at that point. So it's a very gradual and slow process. And so at the first recognition of it, once I finally came to the point that I knew that I had a hair loss problem, I knew I needed to correct it. So that's at that point where I started my search for a doctor that would be able to fix my hair for me, whether that's medicines, whether that's a surgery, whether that's treatments, whatever the case might be. And I started exploring a few options. Couldn't quite connect with the doctors that I had met with. So at that point, I'd actually resigned myself. I was like, you know what? I think maybe this is the opportunity for me to just accept my fate, shave my head, and just be bald. Like maybe that's the next stage of my life. So I had come to that realization. I was like, this is it. I'm done my search. I'd met a client for a meeting, a brand new client, and they had told me right as soon as I met them that the person that referred them to me actually told me to look out for my hair because I'm the guy with the cool hair. And at that point, I was like, oh man, I cannot shave my head. I cannot give this up. I have to go back on the search for a doctor. So at that point, I actually met with Dr. Sharma and the Sharma clinic, and it was an instant click. Honestly, it just, he was very open. He was very honest. He was very blunt. Which is what I appreciated, and it was just an instant connection. And I was like, this feels right, and this is the doctor that I do trust with whatever the course is going to be going forward. So that's when I essentially signed the papers and moved forward with it. I was like, let's start this hair restoration journey at that point. So that's kind of what made me choose a Sharma clinic and actually choose to go forward with the hair transplant. And now I'm going to share with you some pictures and take you through kind of my journey. And it's really weird because this kind of feels like a reunion episode of a TV show because I'm looking at these pictures and I'm just so shocked when I look at them. It's actually quite ridiculous that I let myself get to this point, but I corrected it. So I'm happy with that at the end of the day. So right before I started my journey, like I said, 3 years ago, June 28th, 2019, that is when these pictures were taken. At this point, you can see my hair had recessed quite a bit at this point on both sides. There was also a lot of thinning in the crown. So I was like, whatever we can do to kind of correct it. So my first surgery after consulting with Dr. Sharma, we kind of agreed to about that 2,200-ish grafts for my first surgery. At this point, a second surgery was never really on the table. I thought, let's just do a surgery, let's move forward, and let's kind of get past this. So we'd agreed to it. We moved forward, and this was kind of my before pictures, June 2019. Post-surgery, there we go. 7 weeks post-surgery, you can see the grafts are all nicely quiet in there. So like I said, it's a real roller coaster of emotions. I had never shaved my head in the first place. And I think I actually bothered Dr. Sharma a few times. I was like, do I need to shave it? Do I need to shave it? And yes, you know what? You do need to shave your head. Placement's going to be better. Whatever science is behind it. I'm not a doctor, but you know what? I'm going to trust the process and move forward with it. And I'm so glad that I did. So at that point, I shaved my head. He had moved forward, did the surgery, and you can see now the grafts are all placed in there. And I was very happy at this point with the results. I was like, you know what? I don't actually mind a shaved head, especially with the grafts placed in there. Maybe this is a look. Maybe this is something I'm going to do going forward. So just 7 weeks post-surgery, I was already really excited about what this was going to look like. Dr. Sharma did mention it earlier that there's the shedding phase. So that's the next stage in the roller coaster of emotions, because the shedding phase then happened shortly after this. And all of that kind of went away, and I just kind of looked like I had a shaved head with massive recession. So I was, wow, again, at that point, I was like, well, what happened? Did I make a mistake? No, let's trust the process, be patient, keep your aftercare going, and let's move forward. And I'm so glad that I did that, because fast forward here to the 6 month mark. Too far, there we go. 6 month mark. It filled in really nicely. At this point, I was extremely happy. It's just night and day at this point, from even just 6 months ago, to see this much growth and this much like thickness and density. And it was very clear from the beginning that results can take anywhere from 12 to 18 months to really see maximum results. And at the 6 month mark, I was already really happy with what it was looking like. And I was like, wow, I can't even imagine what it's going to look like in the next few months, and how much more growth and density there's going to be at that point. So again, fast forward a little bit here. We're now at the 12 month mark. As you can see, another new hairstyle, because second chance at hair, I'm going to do every single hairstyle in the book at this point. So at this point, you can see massive hair growth, massive density. This was just, I was just absolutely flabbergasted at what actually we were able to achieve, and how many years it had taken off of my age, essentially. So I was very happy at this point. And I could have walked away absolutely at this point, being 100% happy. I do want to preface, the second surgery that I did want to get shortly hereafter wasn't because I was unhappy with the results. It's because I was so happy with the results. I kind of became a little greedy. I wanted a little bit more hair, because I was like, now I can do so much more with it. And I know what I can achieve and what we can achieve together here. So that's when I decided this is actually a really great opportunity for me, especially in this time that I'm in. If I'm already in this stage, might as well kind of get it all done at once. So at that point, I decided it might be better for me to fill in this section just a little bit more, bring my hair down slightly lower. Again, when I was much younger, we're talking 15, 20 years ago, my hairline actually came down really low. My friends like to joke that basically my hairline connected to my eyebrows, because I basically had no forehead. So again, from my own internal perspective of myself, I'm used to my hairline coming way down up to essentially over here. The really nice thing about Dr. Sharma was that he was very honest and said, that's not going to look realistic anymore, and you've grown up since then. And we had a really good in-depth conversation about it. And I agreed at that point. But I did want to bring this section down just slightly, a little bit more. So that's when we started the next consult process and the next surgery process. And then again in August of 2020, I did an additional 1,500 grafts to bring that hairline down further. So this is actually before the second surgery. So now this is August 2020, which would have been just over a year past my first surgery, which again, I'm not complaining. I would have walked away here really quite happy with everything, but I wanted to, for myself, bring down my hairline just a little bit more. So we got the 1,400 extra grafts or 1,500 grafts added in. And you can see 6 months post-surgery, it's really, this is actually a great comparison picture right here. You can see right here, it's really just this section is all I was kind of looking to target, and that's what I was able to achieve. You can see the hairline is actually quite straight, realistic. It doesn't look fake in my opinion. Some people might beg to differ, but I think it looks fantastic, realistic, and looks like an actual hairline, complementary of my age and my stage in life. So that's 6 months post-surgery, and now here I am sitting 22 months post my second surgery, and you can see right in the pictures or in the video, where's the camera?
Here we go.
Yeah, there we go. You can see like it's completely filled in. It's extremely dense. It actually doesn't even look like I had gotten any type of surgery whatsoever. It blends in nicely with all the stray little hairs that I have. It looks realistic. It's given me so many options. And it's really, like I said, given me that second chance back at having hair again and really taking care of it. So that's kind of the journey that I went through, and I hope those pictures were helpful for you to see. Like I said, it feels like a reunion episode. I hate looking at those pictures, but I also love looking at them because it shows how great of a decision this was for me and how happy I am with the decision to go ahead with this FUE hair transplant. Some of the takeaways that I had post-treatment: aftercare is so important. And, you know, also hair maintenance after that, really, really important. Like I said earlier, I used to do so many things to my hair: straighten them, color it, glues, hairsprays, hair dryers, you name it. Like I did so many things. And I really shifted that once I got my hair transplant, really making sure that I take care of my hair at this point. So a much more gentle approach, a much more natural approach, letting my natural curls come through, switching to products that are oil-based or sulfate-free, all of these types of things. This is stuff that Dr. Sharma had shared with me, something I never actually really considered, but I was doing damage to my hair. So again, over the past 3 years, I feel like my hair has never been as strong, as healthy, as shiny, as long as it's ever been before. So the aftercare process, super important, but hair maintenance going forward after that, really, really important to make sure you upkeep your results and you don't just throw away your investment essentially. Some tips that I always say for people that are considering the hair transplant: number one, you know what, let's drop the stigma, let's get rid of that, start the conversation. Hair loss is not really something that's in most people's control. The aftercare and the maintenance, all those types of things are 100% in your control and your onus. The onus is on you to make sure you upkeep that. But in terms of hair loss, for the most part, is really not something you can control. So why is there such a stigma around it? Have that conversation. Have that conversation with your family, your friends, your significant others, and then with your doctor. If it's something that's bothering you, don't be shy about it, bring it up, because it's really something that can either hopefully be corrected or fixed moving forward. Next tip for people considering hair transplants: be realistic and manage your expectations, especially when it comes to the results. It's the human body. It's not a perfect procedure that can always happen. It's really going to be dependent on your body and how it reacts to it and all the other circumstances. Again, I'm not a doctor, so I can't speak to all that science stuff, but again, manage your expectations and be realistic. Remember, your body can only do so much. So work with it, work with your body and try the best that you guys can do together. Next thing that I'd say is be patient. Ooh, those few months after those surgeries, you're so eager to see results, but it is a patience game. In my previous videos, I always say it's a marathon and not a sprint. And that is 100% accurate because I'm one of the most impatient people. If I get a surgery today, I want to see the result tomorrow. And that is just not the case. It is short-term pain for long-term gain. So again, really make sure that you're patient and very diligent with the aftercare and also with hair maintenance going forward. And really my last tip, and this is one that I say to anyone that's ever messaged me or talked to me about it: do it for yourself. Don't do it for anyone other than yourself. If it's your family member, friend, significant other, anyone else that's bugging you about it, not worth it. At the end of the day, this procedure should be 100% for yourself. And if it's going to make you happy, that's all that matters at the end of the day. So that's kind of the tips that I like to share. Like I said, it always starts with a conversation. Drop the stigma, no need to be shy, book a consultation. Talk to your doctor, talk to Dr. Sharma, see if it's a fit for you, and see if it's something that you actually want to invest in and move forward with. It's one of the best decisions I made in my life. I always used to say laser eye surgery was my best decision. And you know what? It was my best decision until I got this surgery. This then absolutely trumped that. And I am so happy that I have a second chance at having having hair again, and having this youthful look again, and being able to express my personality and creativity through my hair. Again, I said it was one of the best decisions I made, one of the best experiences I've had in terms of a medical procedure, and just I'm happy to advocate and happy to answer any questions or any concerns anyone obviously has at this point. So that's really my spiel. Not a paid advertisement at all. I did this because I love talking about my hair and the experience that I had here. So I'm going to tag, I think, back Dr. Sharma to come back into the screen here, and we're probably going to move into a Q&A here.
That's correct. Actually, what I'll get you guys to do is Ally's going to swap over to this chair. We'll get Dr. Sharma in as well. And essentially, this period is your turn to ask questions to Dr. Sharma or Ally. We have a few queued up already, so we're going to start from the top. I noticed some people are sending your questions in the chat. Make sure to send that in the FAQ, but we'll still get to the ones that have already been sent through. I think the best place to start would be the top of this Q&A list. So anything medical, I'll get Dr. Sharma to ask. And if there's anything direct you want to direct at Ally, send that through as well.
Okay, so the first question I see here is, can you take donor hair from the beard? Yes, you can. It depends upon how many grafts you actually need, what the recipient demand area is. If it's a large area, of course, we're going to be limited by how many grafts we can take. Also, it depends upon the beard type. Say, for example, your beard's very stringy. That stringy look is also going to replicate itself once the hair is transplanted. And I sometimes tell patients who are fixated on getting body hair transplant or beard transplant, it can sometimes almost look like having pubic hair on your scalp, which isn't the most aesthetically pleasing result. So of course you can do it. Just because you can do it doesn't mean you should do it. So with some cases, for example, burn victims or patients who've had cancer, where we really have no options and they want to really, take anything they can, of course, we proceed with this technique. I'm at stage 5. Approximately how many grafts would I need, and what would be the cost? And what about taking grafts from my beard? Okay. To be honest with you, if you're at stage 5, like I said to you, I think you should go and consult with your family doctor and really try to stabilize your hair over the next 18 months. That's honestly the best advice I can give you. Forget about surgery at the moment. Forget about costs. Really just go and try to stabilize your hair and see your family doctor. Give it 18 months to 2 years. Be patient, like Ali said. Hair is slow, and then consult with us. Let's move forward. Is the new hair actually permanent? Very, very good question. So the grafts or the roots that come from the back, these are likely not sensitive to DHT. And DHT is the hormone, or one of the byproducts of testosterone, that attaches to the receptors in the follicles on the top. And that's what actually leads to the thinning or the miniaturization of hair. Now, if you're taking hair from the back, we know that it's very unlikely that these follicles have the receptor. So it's very unlikely that once we transplant, you're going to lose this hair. Of course, with the passage of time and age, cells are going to diminish and sort of die. But usually it's very, very uncommon for you to lose transplanted hair. The hair that you were born with, of course, after transplant, that's a different story, because that's under the control of DHT and your normal genetics. And that's why it's so important to stabilize the hair using medications. And that's a whole different conversation which we can get into.
Is hair loss related to stress? Absolutely, absolutely, Sarah. Obviously, there's so many different causes of hair loss. With stress, we know that after an operation, a traumatic emotional event such as bereavement or a divorce, etc., cancer, radiotherapy, you can get a condition called telogen effluvium, which the layman's term is shock loss. And what happens is one starts to shed almost like a dog. You're shedding and it's coming out of the shower, and the loss is insatiable. This condition sometimes is delayed after the initial trigger. So during the history, we always had to ask about, was anything stressful happening in your life? Did you have an operation, etc. So if you are having sudden onset of hair loss, please go and see your family doctor and get a proper medical consultation, because there may be things that you need to be screened for. So this is not an aesthetic problem, this is more of a medical problem. But yes, Sarah, completely right. How do I know how many grafts I will need for surgery? A consultation. It's impossible to know. I need to touch the scalp. Sometimes with a video, we can actually get a rough idea during the consult, but I always tell patients, it's better to come in, let us feel the scalp, and we'll give you a guesstimate. How many hair transplants do we do ourselves? So we are normally doing during January to September. We normally do 2 to 3 surgeries a week. I used to do maybe 3 to 4 in the past. I only try and do 2 surgeries a week now. That's why we are getting a little bit backlogged, because I'm getting older and I want to make sure my hands are fresh. During winter, we do increase that to maybe 4 or 5 surgeries a week, because September to December is the busiest time for us. Everybody wants to have their surgery during fall and winter, so they can take the darker winter months in Alberta to sort of recover. Usually during the summer, people want to go on vacation and they want to enjoy themselves. Because surgery, it is an ordeal. Like Alys said, it's a roller coaster. You will look disheveled for about 10 days. Sarah asks, what is the most fun part of the procedure to do? For myself, the harvesting is really fun. It's a technical sport. It's about making sure your angles are correct, getting out the grafts in a clean go. FUT surgery is very, very fun as well. But yeah, I think the whole sort of array really, with surgery is a real pleasure to do, because you do the surgery, you put in the sweat and the hard work and the hours, and then it's lovely to see patients back at 12 months and you're like, wow, I actually, contributed to this. Ali, be honest, did it hurt?
I will absolutely answer that honestly. So the actual procedure itself, it didn't hurt with the anesthetic and everything that was happening there. The actual procedure, absolutely not. It was very comfortable. You do hear weird little sounds when you're getting inserted or getting the grafts taken out, so you can hear things, but you don't actually feel any pain. After procedure, what I found was that where the grafts were actually placed, it wasn't painful, but it was itchy. So there was a little bit of itchiness post-surgery, of course, with the scabbing and everything that's happening. It was a little bit tender where the grafts were harvested from, but nothing that over-the-counter pain medication didn't solve for me. So I just popped Tylenol, Advil, and I was good to go essentially the whole time. So it was tender to touch or to sleep on, but that really maybe lasted 2 weeks, if I remember correctly. At this point, I don't even remember, but it was minor tenderness at that point.
And one thing I would like to say is during the surgery, we have to put the scalp to sleep somehow. So, we have to anesthetize you, and that does involve a needle. And the anesthetic is usually based in an acidic solution. So that is going to be nippy. Now, depending upon person to person, I personally, I've not had hair transplant surgery myself, but I have had local anesthetic, and it does burn. And that can be quite uncomfortable. So you're going to have a series of injections around the base of the scalp here, and then also across the forehead there. And I would say that is going to be uncomfortable and painful, but that will last literally 2 to 3 minutes once we basically make the anesthesia and after that you're nice and numb. But I think usually by day 2 with post FUE technique, there's hardly any pain. We often have to tell patients, please don't become complacent, you don't have any pain, but that doesn't mean that you're going to be, sort of jumping up and down and going skiing the next day. So you have had surgery, do take it nice and easy. Okay.
I thought I would just jump in quickly. We have another 15 minutes for the Q&A period. So get your last questions in. I think we have about 10 more to get through. And then we'll be moving to the final section, which will be Dr. Sharma assessing your photos that you sent in. After that, you can send any questions through, but let's let these guys keep doing what they do best.
Sure. Ronnie says, I'm more focused on getting hair in the front, and I was told I may need about 1,500 grafts. How much will it cost? Ronnie, I don't really deal with the costs. It sort of varies from person to person. You're very welcome to contact the office, and they can give you some more information on this. Okay, let's keep going down. Ali did the 2 surgeries you had. Was it worth it? What challenges did you encounter during the journey of hair transplant surgery?
So the 2 surgeries, was it worth it? Absolutely. If I had to do it again, I would absolutely do it again. Do I need to do it again? No, because I am very satisfied and nothing has fallen out and everything looks fantastic. So 2 surgeries, absolutely worth it. For myself, totally worth it. The challenges that I encountered, again, like I said, because hair is such a big part of who I am, shaving my head was one of the biggest barriers I had to kind of get over first and foremost. Once my head was shaved, after that, I mean, I did have the luxury of being able to work from home. I don't know what the aftercare is now or what's being recommended, but I think it was a few weeks where you basically can't put anything in your hair, you can't wear a hat, you kind of have to be exposed. And that was a little bit scary to me. But again, I worked from home and I was able to kind of hide away from people. And I actually upkept the aftercare routine, even though it's only recommended for a few weeks. I kept it up for a few months because I really wanted to make sure that I was getting the best result. That was the most challenging part for me, was dealing with a head that kind of looked a little bit strange, hair grafts growing in at different lengths, that shedding phase. Again, that's really, it's all me really at that point, because you know what? Everyone around me said that they didn't even notice or wouldn't have really paid attention, minus in that first week. But really, that's probably the biggest challenge, was having to deal with what it looked like in the immediate future after the surgery. But again, if you can hide away for a few days, work from home, or once you can wear a hat, you can really get away from blurring eyes, I guess, at that point.
I just like to jump in here and sort of give you my doctor spiel in terms of, is it worth it? You've all heard me saying this if you've come to see me or if you've been under my care. As a patient, for you to understand, is it worth it? You need to really think about, so obviously the results are never going to be guaranteed. We can't guarantee results. Of course, the vast majority of our cases are wonderful, or else I wouldn't be doing this work if I didn't have the passion and we get the results. Of course, there are some instances where things don't go as well. And that sort of brings me on to the fact that there are always risks associated with surgery, medications, with anything in life. Crossing the road carries a risk of being knocked over. You may be involved in a car accident, but we make a choice every day looking at the statistical probability that, is it worth to get in my car and get to work? And the answer is yes, because the likelihood of you having an accident, as long as you're not sort of impaired or your car is not working very well, is very, very low. You're going to get to work in one piece. And it sort of beats getting the bus or waiting for a train in the winter. So with hair transplant surgery, there are risks, and you need to weigh up the probability that if you did get that complication or that side effect, are you okay to accept it? And if you are, then obviously go forward, and then you may be rewarded with the results. And that's a very, very important point. Often my patients, like Dr. Sharma, you're a bit of a you're like the fun police. We want to get these amazing surgery, you want to have surgery, and I'm always the one like, I'm not going to tell you what to do. My job is to simply give you the facts, the risks, and then you make up your mind as a competent individual, because everything in life carries risks. And for me, it's always understand the risk first and then move forward. We've got Cam says, how often do you recommend PRP therapy or treatments? Is it more successful than medication, in your opinion? I'll be very blunt with you. No, don't do it. If you've got some sort of conditions like alopecia areata or intelligent effluvium, in my personal opinion, I'm saying personal because there's no large research studies to fall back on, so I'm not going to say this has been absolutely clinically verified, because it hasn't. PRP is still very experimental. I've not seen effective results with PRP with androgenic alopecia, especially in stages 3 to 5. I think if you've not had hair there for a couple of years, it's an absolute waste of money and time. And that doesn't mean do surgery either. All I'm saying is, if the roots are not there, what are you actually trying to work on? The roots have probably died, and you're simply putting in PRP into skin. So yeah, that's my opinion about PRP.
We only have time for about 2 more questions. I'll ask that you answer Denzel in the Q&A period.
Sure.
Section.
Okay. How to stabilize hair loss? Is stabilizing based on age? I mean, hair loss wouldn't be preventing a patient age more than 49. Do we still stabilize? Sorry, is that 40? Mm-hmm. More than 40. If this is androgenic alopecia, I can't comment on your case because I don't know your particular history. But if this is androgenic alopecia, male pattern hair loss, yes, you do need to stabilize your hair loss. The gold standard is a DHT blocker, such as Propecia or otherwise known as finasteride. There are some other options in terms of being a bit more aggressive. But I think the gold standard is the endogenous ingestion of an oral medication to stabilize the hair, because this is a problem between the receptor and the androgen. Things like laser caps and Rogaine and things, they will give you an edge, but it's a very, very small edge. But the gold standard that's going to really reduce the likelihood of you losing more hair aggressively is going to be stabilization. And absolutely, even if you're 40 and above, I mean, really, you need to go and see your GP, go and get a proper medical assessment and get onto some sort of stabilization medication. Of course, the medication carries a small risk of side effects. You will have to discuss that for your individual scenario, but that's done between you and your GP.
I think that's fantastic. You kind of answered Leslie's question in the chat, was regarding finasteride and long-lasting effects. Do you care to touch on finasteride any further?
I think obviously there's very, very rare side effects which have been reported in small studies. When you look at side effects and et cetera, there are lots of different studies that have been done, some involving 200 patients, some involving 100 patients. Now, myself as a doctor, obviously, I'm a bit of a nerd. I love reading about these things and keeping up to date. But you need to sort of really cherry pick the research studies that really matter to you. And for myself, I'm not going to implement guidelines in my practice that are based on 150 or 200 patients. I want 5,000 patients, 10,000 patients with robust clinical controls. So one of the largest ones that was done by Merck involved roughly 5,000 patients. And the main takeaway from that, there's a 1.8% risk of sexual dysfunction, soft erections, lower libido. So the way I like to term it is, there's a room full of 100 men, you go to a party, and it's a probability that 2 out of these 100 men may experience the side effects. If you stop the medication, of course, they will relinquish the side effects. And secondly, there are other options in terms of taking the medication 3 to 4 times a week. But, you know, any medication we take, Advil, Tylenol, there are certain risks involved. And unfortunately, I always tell patients, my favorite line, as physicians, we cannot take risk away. So this webinar is not about come and do surgery and it's the be all and end all. It carries risks. We can't take them away. You know, results are obviously obtained with the fact that there are certain risks that we accept and move on with. But for myself, I think the risk is quite small, you know, in terms of the benefits that the patient achieves. But that's something that you need to make up your mind on.
I believe that is all we have time for the Q&A section. Lastly, the last part of that question, and if you care to answer, Ali, she asks, is the guest currently using finasteride?
I am not using finasteride. I'm using dutasteride. So what is it compared to finasteride?
So dutasteride is in a similar family as finasteride. It's a DHT blocker. It blocks two enzymes, and I won't get into that. We bore a lot of you, but it blocks it reduces the conversion of testosterone to DHT, so you end up with more testosterone, less DHT. It's a little bit more effective at doing that. It's used off-label, which means it's licensed for prostate problems in Canada, but as physicians, we use it for more aggressive cases with the patient's consent, of course. And we elected for dutasteride with Ali because he really wanted the aggressive results. Slightly higher side effect profile, but slightly higher. But we had a very careful discussion, went through the consent forms, and so he's actually on dutasteride, which is stronger than finasteride. But so he's on.
Yeah, and I've been on that for 3 years, and that's what I was alluding to with hair maintenance afterwards. The meds are part of that as well. So I have no intention of stopping dutasteride because I've seen fantastic results with it. So onwards and forwards with it.
Fantastic. Well, that is all we have from Ali today. If you'd like to say a little outro, go ahead, and then we'll finish up by doing the photo review.
Sure. Thanks so much for allowing me to be here today and sharing my story and journey. Thanks to Dr. Sharma and to the Sharma Clinic. They've been fantastic to work with, a great experience, and I'm so happy. Again, do it for yourself and start the conversation. That's the last 2 tips I'm going to leave you with is if you're considering it, have a conversation, have a consultation, and see if it's right for you. That's all for me. Thanks, guys.
Thank you, Ali.
Perfect.
Okay.
All right. So everyone, we have about 15 minutes to go through some photos. We have a little bit of a presentation of the photos that were sent in. We'll go through them fairly quickly. We've done everything we can to hide the identities of the patients who have requested it. Leslie, I did receive your email. If we have time, we'll get to your photos right at the end. So allow me to prepare the presentation here. Much like last time, we'll be sharing our screen, and here we are. So you can use the left and right arrows to navigate through, and I'll leave you with Dr. Sharma.
Okay, guys, so these are pictures that have been sent to us for this webinar. It's always nice to have a look at realistic photos. All of the patients have given us consent, but just to apply an extra level of security, we have blocked out their faces for confidentiality. It's very, very important that everyone in this chat treats these photos with the utmost respect, and no negative comments, please. So it's the first time I'm seeing this gentleman. Hair loss, thinning, general hair loss. Okay, sure. So obviously, as you can see, he's got thinning to the front, the mid zone, probably in the back as well. As we can see, the hair loss is centered around the front and the crown. Sides look pretty thick to me. I can't comment exactly on this because I need to see this patient. But from what I see, this man would benefit from stabilization, a consultation, and of course, he may need some restoration in the mid-front zone to sort of give him more density there. Okay, this chap, crown, front, and mid zone, quite advanced hair loss, as we can see. We've got the donor area there. It's very difficult to assess the donor area. I've not touched it, so I can't comment on how thick it is. I think this patient definitely needs a medical workup first, go into a GP, make sure, it looks like androgenic alopecia, but of course, I'm just going on photos, and that's all I can say. But I would think he needs to be on stabilization therapy, go and see his GP, be on stabilization therapy for 2 years, and then consult us if he so wishes to proceed. This is actually a patient that we operated on, actually. She wanted her hairline to be lowered, a female, And this is kind of where she wanted it to be lowered to. Of course, being Mr. Skeptic, I told her, you know, to go a little bit higher, to be realistic. And we did that. We went a little bit higher to make it more natural. And we did the FUET technique with her. And her condition was really genetic, no medical issues. It wasn't even androgenic alopecia, just genetically she had a higher hairline than what she wanted to do. We also did discuss the other alternatives of a scalp reduction in terms of, I was going to refer her to one of my colleagues, but she didn't want to go for the drastic scalp reduction. This patient here, he's got a touch of 2A. As we can see, he's got some thinning. Of course, I've not seen him again, so I can't comment on the actual diagnosis, but he obviously does require some filling in the front. If this was androgenic alopecia and he did want surgery, this would be a smaller case. Also, the corners here could benefit from having a slight top-up as well. This patient here, the one thing that really stands up to me is he's got a lot of thinning and the hair's very fine on the top. It's almost like a feathery, wispy look. That's called miniaturization. So this does look very typical of androgenic alopecia. Obviously, I can't touch the hair or can't look at the back, so I can just go on these photos. I think he would definitely benefit from a possible intervention and also most definitely stabilization with medication for the rest of his life. As I always say, if you're not going to take the medication, the risk of you having poor results in the future because your native hair going to continue along the evolutionary trajectory are going to be low, because the overall density is a combination of your native grafts plus the transplanted grafts, and we're always interested in bulk. So if you're not going to take the medication, I'm very, very honest, you can have surgery, but just be realistic that you may need several sessions and the results may be suboptimal. So this picture here, whoever this is, I do think you should go and get a medical dermatology opinion because this does not look like classical androgenic alopecia to me. It's a female, of course. There seem to be some lesions in the middle of the scalp. I can't see exactly, it's very, very fuzzy. But whoever this is, or whoever you are, my dear, I would like you to go and see your GP, obviously get an opinion, and if there's still something which is outstanding, please do try and get a referral to one of our excellent medical dermatology colleagues. But this is not something aesthetic. I think you should definitely go and seek some, a dermatology opinion.
All right, so we do have time. We had 2 last-minute submissions. I believe it's Denzel and another one. I'm just going to close the screen so as not to accidentally release your email information. So just bear with me for 1 moment, and I will be bringing up your photos.
Sorry, I just want to ask all the attendees if you just let us know that, do you actually find this useful? Because we do see many, many consults, and a lot of patients are often like, you know, it's very difficult to see you. The waiting time is several months. And I'm sorry for that, because I'm trying to sort of have more of a relaxed family life now. And, you know, this is more like a little passion project of mine. So if you guys find this useful, every couple of months we can do one of these webinars, and it'd be nice to sort of, you know, send in your information and we can go through some things. I don't mind giving up my time every couple of months if that makes it more accessible for the wider population in terms of sort of getting some advice. Because I think sometimes with these webinars, often, you know, we are a business and we do need to charge for the services that we provide. But I also understand that there's people attending here from all around the world. And sometimes it's not about you guys being in here and then converting to surgery. That's not what this is about. This is really about just giving you honest, genuine advice on this topic, because I do it several times a week and I've done quite a few of these now. Too many that I forget to count sometimes. But So if you guys find this useful, please do let us know below, and then obviously we can work this into, sort of more the generalized routine.
Perfect. We have our very first late submission. Here we go. So just using the arrow keys, this gentleman has sent over a few photos. I believe there's 4 in total. So.
Lovely, yeah. So what I can see from here is this does look like just that one, the other here. Yeah. So obviously the donor area, I mean, he's got good yield in the back. I can't comment on the laxity, etc., but he is absolutely suitable, a possible candidate for a hair restoration procedure. Plus, obviously, he will need stabilization. But once again, not medical advice. Simply, this is simply like looking at a picture and commenting on a picture. For me to comment on you as an individual, I'd have to see you, talk to you, understand your medical history, etc. So not medical advice, but this is certainly a case that we could, if everything else was okay medically, actually sort of consider. Yeah.
Fantastic. And the last one moment here. Let me just get that open for you. This last submission is from Leslie, who's been in the chat. Oh, actually, the last one was Leslie. This is Denzil. And here we go.
That's just one picture.
I believe there's multiple.
Okay.
You can just scroll.
Okay, Denzel, yes. So, yes, I see what's going on. You are a candidate for hair restoration surgery, but this is very important for yourself and everybody else watching. If we look at the area that needs to be transplanted, if this is androgenic alopecia, which I can't comment on, but let's just say it is for hypothetical sake, it's a very large area that needs to be transplanted. Therefore, we're going to need a very large supply from the back. And you've got a fixed number of donor grafts. If you're very lucky, we can do 2, 3, 4 surgeries. But I always tell patients, less surgery is always better because surgery carries risks in itself. So what I would want to do here is really to go and try to stabilize this hair. He's got overt miniaturization, it looks like. Go onto a DHT blocker if that is androgenic alopecia via your GP. Stay on it for 18 months and then come and see us. That will give us a more realistic picture about how many grafts you need and whereabouts you are. At this stage, if you did come and see me, if this was, I don't know, Mr. X, Y, and Z, and he came to see me in clinic and obviously everything was fine, I would tell you to go away, get onto medication and come back and see me in 18 months. Simply doing a hair transplant, yes, you'd add some density there, but what would happen in 3 to 5 years' time, A, it would look very, very weak, B, you'd continue losing your hair, you're almost chasing your tail, and C, you probably need many, many, many procedures, and that's going to diminish the aesthetic look of the donor area. And I always tell patients it's important to make sure the back looks nice as well. I see too many patients walking around who have the donor area looking like a rhinoceros's hide, and that's not the aim of aesthetics surgery. You want the back to look nice as well. So please go onto your GP and get a proper assessment. You're not a candidate for surgery at this point at all. Go onto your GP and get some realistic advice. Simply laser caps and shampoos and things are not going to work. You need to go and have a conversation about getting on some endogenous therapy. I do hope that helps.
All right, and that is essentially everything we have for today. We are just on time, so I thought I would say, firstly, thank you so much to everyone who came to this event. We love hearing your questions. It's a lot of fun to just shotgun blast everything that you're asking. And it's nice to hang out with Dr. Sharma and Ali, who has become very familiar with the clinic and everything we do. So thank you again. I'll let Dr. Sharma do a sign off and then we'll end the webinar.
Yes, thanks guys. Thanks very, very, very much for your time. And now I have to go to the vet with my 2 dogs and try to get some of their lumps and bumps fixed. So yeah, it was great seeing you all. Take care. Bye-bye.
Perfect send off. Goodbye, everyone. Thank you so much.